Okay, welcome everyone. My name is Sabrina with the Plano Public Library. I wanted to welcome you and thank you all for joining us for today's program, Medicare 101. Please note that your microphone and video have been turned off. If you have any questions, you can type them into the chat or into the Q&A, which you can access at the bottom. I will be watching the chat and Melinda will as well to assist you with any issues and to bring any questions to the presenter's attention. We will also leave time for questions at the end of the program as well. Some housekeeping reminders we would like to share. Note that this program is being recorded and will be made available on the Plano Public Library YouTube page for later viewing. And we ask that everyone please show respect for our presenters and one another throughout the program. And so now I will go ahead and I will hand this over to our presenter, Simon.
Well, good afternoon, everyone. Glad y'all are here. I want to welcome you first for joining us here today. I want to thank you for attending. Again, my name is Simon. I'm a benefits counselor with the Area Agency on Aging. That's part of the North Central Texas Council of Governments. And with us also here today is the Area Agency Supervisor, Ms. Melinda Gardner. She's my supervisor, so she's going to be helping me out with the presentation for today. Okay. Ms. Melinda, can you say hi?
Hello, everyone.
Thank you. Okay, and here we're going to get into this. This presentation is dealing with Medicare open enrollment for 2023. And right off, we have a little video to present to y'all.
Things change over time, so it's important to review your plan every year during open enrollment. When you contact your SHIP, a counselor will give you one-on-one confidential guidance based on your unique needs. SHIP can help you understand costs and coverage, compare options, find providers, correct billing issues, and more. Our counselors are members of your community and many are volunteers. They are screened, trained, and certified as Medicare experts. SHIP isn't reimbursed by health insurance plans or paid per enrollment. So our only priority is helping you make informed decisions about your care and benefits. Navigating Medicare can be complicated. SHIP can help. Find your local SHIP office at shiphelp.org or call 877-839-2675.
Thank you. And like they were saying, yes, we are local. I am a SHIP certified counselor here in the state of Texas, and I am in Arlington. That's where our main office is at. We are in Arlington next to Six Flags. I'm assuming everybody knows where Six Flags is, but that's where our office is, here next to Six Flags. And as far as the CHIP, which the abbreviation for State Health Insurance Assistance Program, we can help you because there's several of us that are here locally that can help you with the information that you need. We give unbiased options that are available to you. We're not going to push a particular insurance company plan or anything to you. Otherwise, rather what we do is we will let you know what options are available to pick through Medicare, and whether it's a Medicare standalone prescription drug plan or a Medicare Advantage plan with prescription drug coverage. Also, when you contact us, your information is kept confidential with us. We don't give out your information to anyone or any other organization and anything like that. So we hold on to your information with us within here. Okay. It's as far as the state health insurance program, very knowledgeable group of individuals. We get trained from year to year from different things that we need to know as far as being with Medicare and then the plans that are available to you also. You're going to have access to my phone number so that you can call me and I can talk to you over the phone. But not only me, but there's also at the beginning of the program, on the first couple of slides, first slide you would have seen Felicia Warner. She is another one of our benefits counselors that is available also to you to help you with any information that you need. So you can call us. We can do one-on-one in-person visits with you. We have to, because we are scheduled to different areas in the different counties that we cover. Our particular agency covers the 14 counties that surround Tarrant and Dallas County. And like I'm saying, there's 14 different counties. So there's times that we'll go within the month, we'll go out to Granbury, which is Hood County. We'll go out to Frisco. We'll go out to Denton. We've been out to Flower Mound. We go to Plano, McKinney. Those are the different areas that we can go. Go do the one-on-one information. Also, we are getting into, because of COVID, we're getting into the virtual aspect of things, which is what we're doing right now, getting the information to you virtually. Okay, next slide, please. And as far as with the CHIP program, there are 54 CHIP programs within the United States. There's one in every single state. There's also in Puerto Rico, Guam, District of Columbia, and even the U.S. Virgin Islands. There are approximately 2,200 local programs available for individuals in the United States. There's about 12,500 counselors available within the United States. We do within the United States about 4 million individuals, or we've educated at least 4 million individuals, and within that, 2.5 million counseling sessions have been done by CHIP counselors within the United States. Next slide, please. And this is some of the questions that individuals that contact us call. And this is, you can enroll in Medicare whenever you want, is some of the questions that we get. And that's a true and false question. And what is the answer? It is false. No, you cannot enroll into Medicare whenever you want. There are rules for each type of enrollment period. Right now, what's fixing to come up is the Medicare annual enrollment period, which is also referred to as open enrollment, and it's from October the 15th through December the 7th. Okay, the next is Medicare. Does it cost the same for everyone? True or false? What do you think? Does it cost the same? Go ahead. False, because the exact amount that you pay depends on the specific coverage you have, because some of the plans that are available through Medicare, the doctors that you see, the cost can be different, so it's not going to be the same. I've had some individuals call and ask how come their procedure costs more than their cousin procedure in a different county, and well, that's part of the reason, because it's not all the same. And the next question that we get sometimes, does Medicare cover everything? True or false? And the answer is false. Medicare Part A and Part B do not cover most prescription drugs, routine dental, vision, or hearing. Next slide, please. What is Medicare's open enrollment period? Like I mentioned before, also called the annual election period or fall Medicare open enrollment period. It is from October the 15th through December the 7th each year, and changes when you request to make an open enrollment change. Your change takes effect on January 1st of the following year. You can make as many changes as you need to your Medicare coverage during Medicare open enrollment. The last change submitted will be your plan for the next year. Next slide. What is Medicare's open enrollment period continuing? The changes you can make include join a new Medicare Advantage plan. You can join a new Part D prescription drug plan. You can switch from original Medicare to a Medicare Advantage plan, or you can switch from a Medicare Advantage plan to original Medicare without a Part D, with or without a Part D plan. Because when you're on original Medicare, which consists of Part A and Part B, Part A covers your hospital costs, Part B covers your doctors and their services. That's considered original Medicare. When you are on original Medicare, you're going to need to enroll into a standalone prescription drug plan, and that's going to be your Part D. Part D for drugs is how it helps me to better relate to it. And then that's Part D. Part B again is for your doctors, for the doctors and their services. Also, just need to let you know that this does not include Medigap policies. That's going to be something else that we're going to be talking about. And depending on where you live, you may be able to buy a Medigap policy, which helps you pay for original Medicare cost only. Next slide, please. During this time, we went too far back. Go one more. Yeah, one more. Okay. And during this time, you should consider the cost, the coverage, and the provider choices that are going to be available to you, depending on where you go, whether you go from, again, original Medicare to a Medicare Advantage plan or vice versa. Find the best plan that is for you. One of the best ways to find out which plan or which way might best work for you, you can ask your doctors, or not ask your doctors, but let them know that you're thinking about switching from one way or the other, original Medicare or the Medicare Advantage plan, and then let them know that you're thinking about doing this. And then you sometimes, not always, but sometimes they will let you give some sort of an inclination as to what might work best for you. Or they're not going to tell you don't go with a Medicare Advantage plan just because they don't like it. Usually when they tell you one or the other, it's because they either don't accept Medicare Advantage plans, but they do accept original Medicare. That's when they'll tell you, no, don't go with a Medicare Advantage plan because we don't accept those. We only accept original Medicare. Now, to explore more information for this, there is a website called the Medicare.gov website. You can also go to the Medicare Plan Finder, which is at the Medicare.gov website /plan-compare. You can also call Medicare at 1-800-633-4227. And then you can also call the Medicare Health or Drug Plans directly to get any additional information that you may be looking for to help you decide which is the best way for you. Again, the time to review and compare plans is from October the 15th through December the 7th. Even if you do not switch plans, it's always good to review, as it could save you some money. Next slide, please. Medicare drug coverage, which is referred to as Part D. Remember, Part D drugs. Plans that offer Medicare drug coverage are approved by Medicare, run by private insurance, because Medicare usually will subcontract with several private and commercial insurances that are available to you in your area, and they are available to everyone with Medicare. There are two ways to get your coverage. You can go with a Medicare drug plan, which is those Medicare standalone prescription drug plans I'm talking about, or you can even get your prescription drug coverage with a Medicare Advantage plan with prescription drug coverage, or have Medicare, or have Medicare health plans with drug coverage. The reason it was kind of split up right there and got me a little confused is because there are Medicare Advantage plans without prescription drug coverage. So you need to be careful which plan you pick as far as Medicare Advantage plans, because there's Medicare Advantage plans without prescription drug coverage. And as you see right there, it says Medicare health plans with drug coverage. Next slide. In order to be eligible, the Medicare drug coverage eligibility requirements, you need to have Medicare Part A, which is the hospital insurance, and or Part B being the medical insurance, to join a Medicare drug plan. You need to have either Part A and Part B to join a Medicare Advantage plan with drug coverage. You must also join a plan to get drug coverage in most cases, okay? And live in the plan service area, meaning if you're in Collin County, you want to find a plan that's available to you in the Collin County area. Sometimes individuals move from county to county and try and stay on the same plan until they decide to go to the pharmacy and get some medication. Then they find out, oh, guess what? You moved from one county to a different county. Well, guess what? Now you need to find a plan that's in your new county or your new service area. And there is also even some ways that you will not qualify or be eligible to get the coverage. It's when you are incarcerated, or you are unlawfully present or here in the United States, or live outside of the United States. Yeah, that's when you don't qualify for the coverage, for the drug coverage. Medicare drug coverage, combinations of coverage and cost sharing. Benefit structures for the medications is also available to you in tiers. It's called tiers, and it's copays and copayments. And then the cost of different types of drugs is going to be all involved in the drug coverage. Next slide, please. Next slide, please. I'm sorry. How should I review my current Medicare health and drug coverage? The changes that you can make include joining a new Medicare Advantage plan, joining a new Part D prescription drug plan, or what I refer to as the standalone prescription drug plan, switching with original Medicare to a Medicare Advantage plan, or switching from a Medicare Advantage plan back to original Medicare with or without a Part D plan. Again, this does not include the Medigap policies. We'll get into that later on today, okay? Credible drug coverage. These are coverages that's expected to pay on average at least as much as Medicare standard drug coverage, which has been designated, of course, by Medicare. Each year, plans inform you if your coverage is credible or not credible, and then any lapse of 63 days or more in credible coverage, and you may have to pay a late enrollment penalty if you join a Medicare drug coverage plan later. Okay, so you need to be sure when you become eligible for Medicare and you decide to get the Medicare coverage, you need to also get your prescription, or what they call credible drug coverage, and that's what Medicare refers to it as, credible drug coverage. Be sure and get that coverage. Don't let it lapse. Don't let it go, because if you let it go, eventually you will. It happens every time. Individuals are always calling us that I went to the doctor and the doctor asked me to get this strong medication. Now I went to the pharmacy and the pharmacy is telling me that I don't have prescription drug coverage. I didn't think I needed it. And well, then you find out that you do. And because you didn't get it to begin with, then you're susceptible to a late enrollment penalty because you were without coverage for a period of time. Next slide, please. What are some things I should consider when choosing a Part D prescription drug plan? You need to look at, does the plan cover all the medication that you're taking? Does the plan have restrictions on any of your medications, such as prior authorization, step therapy, or quantity limits? And or how much will I pay for monthly premiums and the annual deductibles? Because most of the drug plans do have annual deductibles, so you have to meet your deductible before the plan starts covering some of your medications or most of your medications. Okay, and then another thing you need to take into consideration is how much will I pay at the pharmacy, copay or coinsurance, for each drug I take. Next slide, please. Again, some of the things that you should consider when choosing a Part D prescription drug plan is your pharmacy in the plan's preferred network. You pay the least if you use preferred network pharmacy. Can I fill my prescription by mail order? So you need to make sure that your plan offers mail order. What is the plan's star rating? And then if you have retiree coverage, will the Medicare drug plan work with this coverage? Because there's individuals that work with huge companies, and then once they retire, the company can't afford to offer some sort of coverage, even though you've already retired and you're on Medicare. And then you need to make sure, of course, that the coverage that you're getting from the particular company that you were with, which again is referred to as the retiree coverage, make sure that it works with Medicare. And yeah, just go with that. Again, the Medicare Plan Finder tool can be helpful to get you a list of Medicare Advantage and Part D plans, the drugs they cover, the cost for your medications for the year. Next month, we will be able to discuss the Plan Finder in detail because you will be able to utilize it. Next one, please. Again, Medicare drug coverage covers drugs, the drugs that it covers. It covers prescription, brand name, and generic drugs, and they must be approved by the U.S., what I call the U.S. Food and Drug Administration, or the FDA. They must be used and sold in the United States, and they may be used for medically accepted indications. In other words, they don't want you to, get a joyride off of a particular medication that is strong and gives you some sort of a high. You're not supposed to use it for that. Get a little humor in there. Also, it includes prescription drugs, biological products, and supplies associated with injection of insulin. Plans must cover a range of drugs in each of the categories. And again, remember, coverage and rules vary from plan to plan. Some plan may cover a particular medication that you're on. Another plan may not cover it. So you need to make sure if you decide to switch, make sure that whichever plan you're going to switch to, they do cover your particular plan. Next slide. Something really neat that the government is finally intervening here and getting in the middle of this and lowering the cost of insulin products, and the Medicare drug plan. It says for Medicare drug plans, which is and even the Medicare Part D plan, the change was effective January 1st of 2023. For Medicare Part B, if you're medically required to take insulin through a pump that's considered durable medical equipment, or DME, this change was effective as of July the 1st of 2023. The cost of a month supply of each Part D covered insulin is capped at $35. Let me tell you, individuals are so excited about that because some of this insulin can run up into $100 easy. And now that it's capped off at $35, it's great. And you don't have to pay a deductible for your insulin either. If you get a 60 or a 90-day supply of insulin, your cost can't be more than $35 for each month's supply of each covered insulin. This new cap should be reflected when you compare the 2024 plans on your plan finder right now, because when this year, at the beginning of this year, again, some of these, the Part D was implemented as of January the 1st, and we were going into the Medicare.gov website to see the cost of the insulin medications that individuals were taking. The cost was not being indicative of the $35 that it should have been showing, but it wasn't. So it was getting a lot of people confused. But again, it says here, as of 2024 plans, everything should be in order. Next slide, please. Required coverage, all drugs in 6 protected classes. First class, cancer drugs. Second is the HIV/AIDS drugs. Third is the antidepressants, the antipsychotics, the anticonvulsants, and the immunosuppressants. The 6th one. All commercially available vaccines is also available. People with Medicare drug coverage, which is the Part D, pay nothing out of pocket for vaccines for adults, including the shingles vaccines that are recommended by the Advisory Committee on Immunization Practices. Some vaccines are covered under Medicare Part B, which is the medical insurance, like the flu, COVID shots, and pneumococcal shots also. Okay. Next slide, please. All right, now we're going to get into the Medicare Advantage plans, and this is going to let you see a little slide here in reference to the Medicare Advantage plans. Go ahead, please.
Benefits. In addition, people with Medicare have choices about how they get their coverage. If you have Medicare Part A and Part B, you may have the opportunity to join a Medicare Advantage plan, sometimes called Part C, if one's available in your area. These plans are another way to get your Medicare coverage instead of original Medicare. Private insurance companies offer Medicare Advantage plans like HMOs and PPOs. These companies contract with Medicare to provide you with all of your Part A and Part B benefits. In addition to your monthly Part B premium, you usually have to pay a monthly premium for your Medicare Advantage plan. Some Medicare Advantage plans offer coverage for things that aren't covered by original Medicare, like vision, hearing, dental, and other health and wellness programs. Most include Medicare prescription drug coverage, also known as Part D. There may be other Medicare health plans offered by private insurance companies. You can review and compare all of the Medicare health plan options available in your area by visiting medicare.gov/plan compare. Remember, you can only enroll during certain times and depending on your circumstances. Timing is important to avoid a gap in coverage and possible late enrollment penalties. You can contact 1-800-MEDICARE or a state health insurance assistance program or SHIP office near you for free, unbiased assistance.
All righty, and continuing with the slide. How should I review my current Medicare health and drug coverage? Regardless of how you receive your Medicare health and drug coverage, you should always consider your access to healthcare providers that you want to see, your access to preferred pharmacies that are available to you, your access to benefits and services that you need, the total cost for insurance premiums, deductibles, and cost sharing amounts, and the quality of the customer service you receive from these companies. Next slide, please. If you have original Medicare, you can visit the Medicare.gov website and then read the 2024 Medicare and You handbook to learn about Medicare's benefits for this upcoming year. You can also call 1-800-MEDICARE or contact our office if you do not have a Medicare handbook. You can receive your handbook by mail or electronically from 1-800-MEDICARE. You can also log into or create your Medicare account to sign for your electronic handbooks. And then, of course, the CHIPS program can also provide a copy to you by mail. You have to contact. If you haven't gotten the book and you'd like to get a book and you cannot get it by any of those other previous ways, then we will be more than glad to mail you one also. We do have some here, not a lot, but we do have some. So if you need one, just let us know. Again, also, if you have a Medicare Advantage plan or a standalone Part D plan, read your plan's annual notice of change, also referred to as ANOC, and or your evidence of coverage. Review these notices for any changes in the plan's cost, the plan's benefits, or should have been coverage rules there, or the plan's formulary, which is a list of the drugs that are available to you through your plan or what your plan covers. Make sure your drugs will still be covered next year and that your providers and pharmacies are still in the plan's network. If you want assistance in reviewing your options, contact, again, your state health insurance assistance program for unbiased counseling. Again, the reason you're hearing that about the unbiased counseling, again, is just that we're not going to dictate to you with a particular company. We're just going to simply let you know what your options are, and then ultimately you make the decision as to which plan you want to go. Next slide, please. This is what are some things that you consider when choosing a Medicare Advantage plan? How much are premiums, deductibles, and co-insurance copays amounts? What is the annual maximum out-of-pocket cost for the plan? This amount may be higher, but can help protect you if you have expensive healthcare costs? What service area does your particular plan cover? Are your doctors and hospitals in the plan's network? What are the rules that you have to follow to access healthcare services and your medications? Excuse me. Does the plan cover additional healthcare benefits that are not covered by original Medicare? Am I eligible for them? And are they only available to certain members? What is the plan's star rating? And then will this plan affect any additional coverage that you may already have? Next slide, please. Again, some additional things to consider. Medicare Advantage plans usually include prescription drug coverage. Okay, so you don't have to pay separate for like you would for the standalone prescription drug plan. In the Medicare Advantage plans with prescription drug coverage, it all comes together. Individuals with Medicare Advantage plans cannot have a Medigap policy. If you have original Medicare and a Medigap policy, you are considering to switch to a Medicare Advantage plan, know that you will lose your Medigap policy as well. You may face limitations with Medigap enrollment depending on the state or in the state in which you live, unless you are eligible for a special enrollment period to re-enroll in a Medigap policy, i.e., first time with a Medicare Advantage plan within the first 12 months of enrolling. If you're enrolling to a Medicare Advantage plan and within those first 12 months, you can go back to the Medigap policy, but you need to make sure that the plan that you were on is still available, and only if it's available also. Okay. Next slide, please. What kind of supplement benefits do Medicare Advantage plans offer? Additionally, a supplement benefit is an item or service covered by a Medicare Advantage plan that is not covered by original Medicare. And to receive supplement benefits, it's important to follow your plan's rules. Some commonly offered benefits include dental care, vision care, hearing aids, and even gym memberships. Some supplemental benefits must be preliminary health related or primarily health related. These benefits can either be optional, where you can choose to purchase if you want additional coverage, and then there's some that are mandatory that cannot decline the coverage. Next slide. If you are interested in supplemental benefits, review the plan evidence of coverage and any other materials that are available to you. Find out the cost and coverage restrictions associated with those benefits. Again, these are additional benefits that are available to you through the Medicare Advantage plans that are not available to you through original Medicare. Medicare Advantage plans can also cover special supplemental benefits for the chronically ill individual and that are not primarily health related for beneficiaries who have chronic illnesses. These benefits address social determinants of health, like you can get meals delivered to you. I'm sure some of you have heard of Meals on Wheels. Some of these plans can offer transportation to and from your doctor's office, and some of them even offer home air cleaners. Not every plan member will have access to the same set of benefits. Okay, so it depends what your situation is. That is going to determine whether you have access to these additional benefits. Next slide, please. Medicare drug coverage cost. During the initial coverage, you'll pay co-payments and co-insurance because there's different phases of the coverage that you're going to get with Medicare drug cost. Okay. So there's the initial coverage, which is where you'll pay co-payments and co-insurance. And then once you reach a certain amount, you will go, the next coverage is called the coverage gap, or otherwise known as the donut hole. You'll pay no more than 25% of the cost for covered prescription drugs once you and your plan spend more than $4,660 combined on covered drugs, including the deductible. And then the last phase is during what's called the catastrophic coverage phase. You'll pay no more than 5% for each of your out-of-pocket, for each of the Medicare, 5% once your out-of-pocket cost spending reaches $7,400. Let me reread that. You'll pay no more than 5% once your out-of-pocket spending reaches $7,400. Next. And again, remember, the cost is can depend according to the plan that you're in, okay? So other things to consider before joining some of these plans. Is your drug coverage as good as credible Medicare drug coverage? Do you have other current health insurance coverage with a particular plan that you're with? And then how does my current coverage work with Medicare? And could joining a plan affect my current coverage or family members' coverage? Next slide, please. What are star ratings? I'm sure you heard me mention in there about the star ratings. Star ratings are quality ratings that provide a measure of a plan's performance. Medicare scores Medicare Advantage plans and Part B plans in several categories, including quality of care and customer service. Customer service seems to be a big one with the company. So ratings range from 1 to 5 stars, with 5 stars being the highest. Plans are assigned an overall star rating to summarize the plan's performance. Plans also receive separate star ratings in each individual category that is reviewed. And then the overall rating provides a way to compare performance among several of the plans. So some plans have 5-star ratings, some plans don't. Some of them only go up to 4. Some of them only have a 3-star rating. But believe it or not, a 3 is good, a 4 is great, but a 5 is excellent. Just to give you an idea how those star ratings work. Again, 3 is good, 4 is great, and 5 is excellent. Next slide, please. Okay, I'm sorry. Star ratings are only one factor to review when comparing plans in your area. That's just one of the factors, okay? A plan may have a higher star rating, but it may not be right for you because either it doesn't cover your medication, it doesn't cover the particular medication that you're looking for. So again, something you need to really take a good look at. It's important to see whether the plan covers the health services and the drugs that you need and works with the pharmacies you currently use before considering its star rating. Keep in mind, the star ratings in the Medicare and New Handbook are not necessarily the most recent. Next slide. Some of the things that are available to you, there's extra help, dual and partial dual eligible special enrollment period, which is referred to. Sometimes you'll hear us talk about special enrollment period, which is also referred to as SEP. If you have Medicare and any form of Medicaid, you can change plans one time per calendar quarter in the first 3 quarters of the year, which is from January the 1st through March the 31st. You can use annual open enrollment periods that are in the 4th quarter to request to change from one plan to the other. But again, remember, during open enrollment, you can request the change during open enrollment, but it will not take effect until the 1st of the following year. And again, it may be a gain, it may be a loss, or change to a Medicare or extra help status. And then notifications of a CMS or state initiated enrollment action. Extra help is a program that's available to individuals that are low income, and they're going to be trying to get help with the cost of their medication, and they call that extra help. Next slide, please. Okay, IRMA. I'm going to talk about IRMA, and IRMA is income related monthly adjustment amounts. Again, this is the Medicare drug coverage monthly premiums, and IRMA is what determines how much you may pay for your drug cost on a monthly basis. Okay, what's IRMA? It's an extra amount some people have to pay in addition to their plan premium. Does everyone pay IRMA? No, it's based on your income. Fewer than 7% have to pay it. What if I owe Part D IRMA but don't pay it? You'll be disenrolled from your Medicare drug coverage. So if you get disenrolled, you're going to need to switch into another plan. And don't think by switching from one plan to another, it'll get rid of the IRMA. No, it's IRMA is like I said, it has to do with your income. Once they figure that out, then you're going to get billed for IRMA. So it's not something that you can switch to a plan and get rid of. Okay. Where does the money go? The IRMA amount goes to the government for the Medicare Trust Fund. Just in case you're wondering where that extra money goes to, that's where it goes. Next slide, please. Income related monthly adjusted amount, IRMA, monthly Part D premiums for 2023. This chart is based on your yearly income, which was in 2021, for what you pay for 2023. So just to give you an idea, individual pays $97,000 or less, or filed a joint income tax return, and between the two, you paid $194,000 or less, and filed married and separate, $97,000 or less. You only pay the plan premium. That's all you're going to pay. If you make above 97,000 up to 123,000 through your tax return for that particular year, then you're going to pay $12.20 plus your plan premium. And as you can see, the more you make, the more you're going to pay. But the most that you'll pay, and that's if you make $500,000 or more, or $750,000 between you and your spouse, because you filed a joint tax return. Or if you're married and separate, it's $403,000. That what was submitted through your tax return. Then the most you're going to pay is $76.40 plus your plan premium, and that gives you an idea of how much you'll pay. Okay, 5-star special enrollment period. You can switch to a 5-star Medicare Advantage plan with or without drug coverage, or even with the drug plan. You enroll once per year from December the 8th through November the 30th. But keep in mind, okay, new plans start on the first day of each month after enrollment. Star ratings assigned in October and effective January the 1st. And then it says you may have a coverage gap and pay a penalty if you switch to a plan with no drug coverage. So again, be careful, because remember, there's Medicare Advantage plans without prescription drug coverage. Next slide, please. Ways to enroll into a Medicare drug coverage Part D plan. You can, if you do it online, you can visit the medicare.gov/plan compare to get a list of the plans that are available to you. Visit the plan's website to see if you can join online, because it'll tell you, it'll give you the option to click so that you can join the plan online, or you can contact your CHIP counselor, which is me or us here, and we can also help you to enroll into the plan. You can complete a paper enrollment form by mail, and then of course by phone. You can call the plan directly that you want to join, or you can call 1-800-Medicare and to contact them and let them know that you want to enroll into a particular drug plan. Next slide, please. What is the Medicare Plan Finder? Again, the Plan Finder, it's an online searchable tool on the official government website, which is medicare.gov. It's available for users logged in to their Medicare account, which is, you get the best experience that way when you have Medicare and you get into this. And for guest users, because like myself, I logged on as a guest, to get basic information on there. Now, if you call me with and we need to find out which plan would best work for you, and you are on medications, if you have 5 medications or less, usually I'll go ahead and do it over the phone. Usually, if it's more than that, I'll ask you to send me a list, and then I'll be able to enter the list, and then I'll call you once I've got everything in, and then we can go through the plan that is best available to you according to the plan finder. Okay. It allows users to compare Medicare health and drug plan options, meaning the Medicare Advantage plans or just the Medicare standalone prescription drug plan, and even the Medicare supplement insurance or Medigap policies. Okay. The plan finder also provides detailed information on coverage, costs, benefits of different plan options in your area based on your prescription. And then, of course, to get some additional information or clarity on that, you can visit the Medicare.gov/plan compare to find plans that are available in your area. Next slide, please. And here's a picture of the main page when you go into the Medicare.gov website. And if you look right under the gentleman, there's a tab there. Oh, go back, please, just so they can see it. Find health and drug plans. That's the one that we generally use to get to those plans that you need. Next. And again, open enrollment. Remember, it starts on October the 15th. Are you ready for open enrollment? And you can prepare by previewing some of the information that is on there. Lower cost for Medicare covered insulin is available, so be sure to get that information. And next slide. And on this slide, you're going to see some information you can that helps you to get through to get the information that you need. Again, the big one that I like is you can find and compare. You can find health and drug plans. You can compare coverage options that are available to you. You can find a Medicare supplement or a Medigap policy that's available to you. All of this information is available to you through there. It's very informative. This is a good website, and almost any question that you might have is there. Now, if you need to get additional clarity on it because you don't understand it, by all means, give us a call. We'll be more than glad to help you with the information that's available to you. Next slide, please. How can you protect, or how can I protect myself from plan marketing violations and enrollment fraud? Because let me tell you, fraud is rampant with individuals that are on Medicare. During Medicare open enrollment, there is a higher risk than usual for fraudulent activity because you got individuals that are calling you and telling you, hey, just tell me what you want and I'll help you out with it. And all they're trying to do is get your Medicare ID number. Once they get your Medicare ID number, they can do all kinds of fraudulent activities with their number. Medicare has rules about how plans can and cannot communicate with you during Medicare's open enrollment period to market their insurance products. Before you enroll in a plan, make sure you understand what the plan covers, how it affects your Medicare benefits and other health benefits like Medicaid or your retiree union coverage, and whether it covers the drugs that you need. Next slide, please. This is do's and don'ts from broker agents that they can do, shouldn't do. I think there's a presentation here, isn't there, Melinda?
No, this is a link on the
Okay.
PowerPoint that will go to this document if individuals print that out.
Yeah, so you might want to write this down, okay? Information and help. Get this agent, brokers, do's and don'ts. And it's in the CMS.gov website, okay? And then again, information and help during the open enrollment period. The best website that I think that is available for individuals on Medicare is the Medicare.gov website. You can utilize the Medicare Plan Finder at the Medicare.gov/plan compare aspect of it, or again, you can always call us, the CHIP, 1-800-252-9240. And that'll get you, it's gonna, when you call there, it's gonna ask you for your zip code or the particular county that you're in, and then it'll get you to us because we cover your area. And then of course, or you can also call Medicare, 1-800-Medicare, which is the 1-800-633-4227. And again, customer services for choosing a plan and enrolling with the Medicare. With the Medicare, they are available 24 hours a day and 7 days a week. The only time that they're closed is Thanksgiving Day. And there's even language line interpreters for more than 200 different languages that's available to you that can help you there. I do speak Spanish, so hablo español. So if you need, someone that speaks Spanish and not too good with the English and wants Spanish speaking, then give me a call. I'll be more than glad to help y'all out too. Next slide, please. And at this point, I know that there was a chat and a Q&A that was available. And if you weren't able to take advantage of that, if you have any questions, go ahead and put it in the chat or even the Q&A, and we'll go ahead and try and answer those as best we can. I don't know, Melinda, did we want to go into that more so right now, or were we going to address that at a later time? Sabrina?
I am looking at the chat. There are comments, but I don't see any questions. So you did a great job with explaining. Give it a few more minutes to see if anyone has any questions about open enrollment, about the plan finder. We didn't go into detail with the plan finder. It has been updated. So it, like Simon said, it's a great website to compare plans. If you actually go to the provider's website, then you may start getting calls or emails from them, but the Medicare website does not send you any marketing materials. So it's good to compare on the Medicare.gov website because that lists all the plans. If you go to one particular company, that's only going to list their plans. Okay, I'm still not seeing any questions. Thank you for the comments.
And this was recorded. So
Yes.
like I said earlier, it will be available for you all, so you can go back and review the slides and get any additional information that
Yes, I will mention I did drop a few links into the chat if anyone is interested. That does include the link to the YouTube page where you can see our past recordings of past programs that the library has done, as well as our calendar if you're looking for any sort of similar programs that might be done in the future. And I believe, okay, Melinda answered that question. Okay, wonderful. And while we wait to see if anyone has any other questions, I will say thank you everyone for attending the program. And there will be, at the end of the program, when we exit out, there will be a program survey which pop up. And we would really appreciate if you fill that out because we do value your feedback. It helps us know that these programs are helpful for you and you'd like to see more like them in the future.
Thank you very much, Sabrina, for having us here this evening as well. We appreciate everything that the library does for the community.
Yes.
Of course, and thank you very much for being here.
Mm-hmm.
Let's see.
I don't see anything.
Okay. In that case, if everyone has down the information that they would like to contact the agency or assignment specifically later on, and I have put the library's links into the chat as well. Okay, I will go ahead and I will thank everyone once again. It doesn't look like there are any other questions popping up. No, okay. So I think we'll go ahead and we'll wrap up the program then. Thank you everyone for attending.
Thank you,
Wonderful.
everyone. Appreciate
Yes,
y'all.
thank
Y'all
you. Have a good evening.
be safe, please. Bye-bye.
Bye-bye.